Good day to all the veterans, their families, and citizens of New Bedford. This morning, my guests will be here to give you information about the VA hospital in Providence, where they work, and also the New Bedford Clinic. As you know, I try very much to bring in anything that's going to give information to both the veteran and the family, especially if you're having hard times and you don't know what to do. We have the facilities to tell you, and that's why I have this program. I have with me this morning Dr. Stephen Mernoff and Marie Sullivan. They both work for the hospital in Providence and New Bedford. Good morning.
Good morning.
Good morning. Priscilla. Glad to have you aboard.
Thank you for having us.
Your position, doctor?
I'm the chief of neurology at the Providence VA. We've got a group of 4 neurologists there, and we run both general neurology clinics and some specific clinics. One in particular is the Polytrauma TBI clinic, which is designed for veterans returning from Iraq and Afghanistan, especially if they've had traumatic brain injury and post-traumatic stress disorder. But we have other specialty clinics as well, a spinal cord clinic that includes patients with Lou Gehrig's disease, ALS, multiple sclerosis clinic, a movement disorders clinic for patients with Parkinson's disease and similar disorders. You're
busy.
Yeah, very busy.
You have quite a few avenues for those that are in need.
Yep.
Marie?
Yes. I'm a licensed social worker in LICSW, and I am the program coordinator for the Polytrauma TBI clinic. I work with Dr. Mernoff, and also for the spinal cord injury clinic in Providence.
So he keeps you busy,
He keeps me very busy.
Okay. That's the type of work you're doing. Now, you're in Providence at the Providence VA,
Yes.
plus you come one day a week, is it you told me?
I come one day a month to the New Bedford clinic. At some point I might expand it, although we're getting so busy at Providence that I don't know if that's going to happen or when. But so I'm at the New Bedford clinic one day a month.
But you are available just in case?
Yes.
And they know of how to send if someone walked in to you?
Well, to get into neurology, patients are referred through their primary care physician.
Okay.
So there are several ways to enter the VA that Marie may be able to speak to. But to get to neurology and the polytrauma clinic, it's usually a referral through either a primary care physician or somebody else who they've seen before they've seen us. So we're not a primary care clinic, but it's not hard to get to us.
Well, most everything we do has to go through our primary.
Yes.
Yeah.
You know, and I just lost Dr. Murphy because he retired.
Right.
Yes, he did.
And now I have a new one I got to get used to.
Yep.
But she seems to be doing very well because through her I got to see you and I had a little complaint. So, Marie, what do you have to handle?
Well, with the program that we work on together, the Polytrauma and TBI, we have a clinic in Providence that's basically a walk-in, and it's designed for the OEF, OIF veterans coming home.
Now, they don't know those initials, so you're going to have to...
That's the Operation Enduring Freedom, Operation Iraqi Freedom.
Thank you.
That is anyone coming home from Afghanistan and Iraq. We have a clinic on Monday evenings and Wednesday evenings from 3 to 6. And it's fully staffed with the program coordinator for the OEF, OIF veterans. I'm part of that. We have mental health providers. We have someone from the regional office who does benefits if veterans want to come in and talk about opening up a claim, or they have questions about education, how they access their GI Bill. We have someone there also that represents the education piece for it. So it's a one-stop for veterans coming in. It's a nice introduction to the system, and then from there we connect them to whatever program they need. My part in that clinic is doing a screening that we have for everyone coming home for exposure to injury, blasts, explosions, things of this nature, where they may have suffered a traumatic brain injury. We do a screening, and then I set up an appointment. If they're positive, I explain to them what we offer in our clinic, and then I make arrangements and set up an appointment for them to come in and meet with Dr. Mernoff, along with myself and a neuropsychologist.
And that's before they go to a primary? They go
It's
through
part
your
of the
department.
whole evening. They see all of the providers, and then they see a primary care physician, so
Oh,
they're
okay.
connected right away to
Right
the
away.
system.
Okay, so they are covered that way. The referrals
Yes.
are there.
Yes.
Women, how many do you have? Any at all that come through?
Yes, we do. The numbers of women are growing, which is very encouraging. We have a women's program coordinator at the VA in Providence, Beth Grady, and she does a lot of program and outreach to engage women. We have a woman physician within our clinic so that we can provide care. If the women vets would prefer to have a woman doctor, we can provide that. And they have groups and things of that nature for the women to educate and connect them with the VA.
Now,
And
the trauma of sexual, you handle that also?
yes.
Okay,
Yes,
because a lot of the
military
girls
sexual
I've talked
trauma.
to have come back.
Yes,
and
it's a
they've had
very-
a problem there.
Yes,
Yeah.
it's
I
a
don't
very
remember that
basic
when I
problem.
was in 49, but I was only 18, so I wouldn't have known anything anyway.
We don't know if it's being just because it's being reported more, or it's happening more, but certainly we're hearing about it a lot more. And there are specialists in mental health who are trained to help women and men. Some men are reporting as well with those types of issues.
Yeah, because I've had a couple that come through my unit in the Legion, and they didn't know where to go. And then I took them to Brockton because they had a women's unit up there that they
Yes.
could help them with.
Yes.
And from there, they took them over and helped them out. It took
Yes.
over a year or so before they could really feel good about themselves, you know. It's a
Well,
trauma.
the VA nationally has required VA facilities across the country to expand their women's health programs, and it's growing in Providence as well.
It has to.
Yeah. It
has
is.
to,
Oh,
because
absolutely.
They're too vital now. The nurses were the ones that suffered in the other wars.
Right.
The women that were did more inland work, and as I did, because I was too young to go overseas. But the nurses would go no matter what, because they
Right.
were needed, you know.
Yes.
And they're the ones that I notice won't come forward. Even today, there's some out there that could use some help, and they're living with a lot of things that went on
Sure.
that they haven't got. Well, this is going to be a relief for a lot of the younger
Yes.
ones. That
And
are
it's very
here now.
successful. They've
Yeah.
had they had a wonderful project that was in Rhode Island at the VA hospital, and then it came down to New Bedford, the Clothesline Project.
Oh.
And it was part with their therapy. It was a therapeutic exercise for them to talk about releasing the anger and the hurt, and they made T-shirts.
Oh.
And it was wonderful. It really was a wonderful exhibit and a wonderful opportunity to be privileged to share in that,
Yeah.
pain and
It was a good
difficulty.
therapy
But it
type
was
thing, yeah.
freeing for a lot of the veterans, men and women. It was a wonderful exhibit.
Now, the New Bedford Clinic, just how involved are you there? Is it just
Well,
that once a month?
I come once a month. I started this about 2 years ago as part of the expansion of neurology. Over the last few years, we've added more and more neurologist time and realized that we were having a significant number of patients not able to make their appointments in Providence because of transportation issues. So we thought that it would make sense for one of us to come out here periodically. And I probably, the need is probably greater than what I can, than my availability out here. So if there's an opportunity to increase my time here or have one of the other neurologists come here occasionally, we'll look at doing that. But it's been helpful to veterans who live on the South Coast and the Cape, so they don't have
Any
to go all the
help
way into
is
Providence.
better than none.
Yeah, and I live in Providence, but I don't mind the drive. It's a pretty drive. And
It
it's
is.
against traffic, so I don't
We
mind
will
it at all.
say it is, won't we? Neurology, specify exactly what that affects. Because there's people probably older out there that it's a word, you know.
Neurologists treat patients who have conditions affecting the brain, the spinal cord, and the nerves that connect from the spinal cord to the rest of the body, basically the limbs. So it ranges anywhere from strokes, Parkinson's disease, brain tumors, Alzheimer's disease, to spinal cord diseases, to nerve diseases like Lou Gehrig's disease and diabetic neuropathy, We treat patients who have migraines, seizure disorders, so it's a very wide variety. And at Providence, of the four neurologists, each of us specializes in, we all see a lot of different neurological patients, but we all have subspecialties as well. So we're able to, for example, when I get a referral for a patient who has Parkinson's, or they're concerned that they may have Parkinson's, I arrange an appointment for them to see Dr. Chang, Dr. Vicky Chang, who's a Parkinson's expert. Dr. Albert Lowe is a multiple sclerosis specialist who mainly does research, but he has a clinical multiple sclerosis.
Has he come up with anything?
Oh, they're working on it.
Because my son has MS.
Oh, really?
And my daughter has MS.
Oh,
I don't know why they both have, but they do.
No, there's a slight genetic predisposition.
You know, they were over 25 when they were affected.
The research that he's doing and I participate in a little bit is mainly in the realm of neurorehabilitation, not so much prevention or specific treatment of the disease, but to try to maximize people's function. And for MS, Parkinson's disease, traumatic brain injury, stroke, to try to enhance their recovery from the functional disabilities that are associated with these
they're
diseases.
Both doing fine. Thank heavens.
That's good.
We've got a laboratory that has a room full of robots, actually, that are being investigated to help with rehabilitation for these conditions. So it's very exciting.
There's so much out there different than it was when they had the measles and the mumps and the chickenpox. I mean, it's become much more in detail.
Oh yeah, we know a lot more.
And it's frightening because the parents come against this, whether they're soldiers or the civilians. Where do I go? How am I going to get some help? You know, so.
Well, the Providence VA is. I've been there for a little over 4 years now, and I see it much more as a community rather than just as a hospital or a clinic. There are a fair number of veterans who actually work there, and there is a remarkable sense of teamwork there, which I think we both enjoy, and the administration there has been very, very supportive of what I know best is our programs, but programs across the hospital. Just in the 4 years I've been there, there have been a lot of changes and improvements and enhancements to what's provided, and it's large enough to have a lot of different services in different medical specialties: oncology, pulmonology, cardiology, podiatry, dentistry, and I'm leaving a bunch out. But it's small enough where we pretty much all know each other, and it's easy to communicate with each other. And veterans often have complex medical conditions where they need coordination among their providers. And at the Providence VA in particular, it's very easy to do that coordination. The Providence VA is a real gem that it doesn't blow its own horn, probably not enough. There are a lot of very good things that go on there, and there's a sort of a younger generation that's coming in to work at the VA now that hadn't been in the VA before. So there's been a fair amount of turnover over the past 10 to 20 years, and along with the what's going on nationally in the VA, the changes that have been made, it's really a remarkable healthcare system. That's a good model, I think, for
which is needed.
Yeah,
and the worst
absolutely.
is yet to come.
Absolutely.
They're not all home yet.
Oh, sure.
There's some still in Korea, which should not be anymore.
Yeah.
That war has been over. The forgotten war, you know, it's been over for ages, and there's still, we've got our own people over there. We don't, they shouldn't be there. They should come home to their families, you know, and heal, because I'm sure there's a lot of trauma there by the time they come home.
We're trying to find ways to include families and others, significant others in veterans' lives if they wish to be part of their health care as well, if the veteran is.
Because there's a lot of older parents that have got younger, even the grandchildren, and they don't know what's going on with them when they come back ill.
Right.
And how are you going to explain it to them? So they've got to be involved to a certain point so they can understand.
Sure, sure.
Yeah.
Yeah.
Something else that's really enhanced VA care over the last 20 years was the introduction of the electronic medical record. Before that, I remember when I was training in the Boston VA, we had huge paper charts, and you know, how can you go through all them? And, but now the electronic medical record, which is now in the process of the system is they're looking at it to update it, but it's a very robust system. So we have patients who spend the winter in Florida or Arizona. We have access to their records. In a couple of clicks on the computer, we can see what went on at a different facility, which makes a huge difference to be sure of what medications they're on, what medications either worked or didn't work in the past, what tests have been done already, so we don't repeat things that don't need to be repeated. It makes it much more efficient, not only in cost savings but in convenience for the veteran, so we don't have to reorder things that were done already and reinvent the wheel. And when we're sitting with the patient, I can pull CAT scan images up, MRI scan images up. I've gotten very spoiled. And my friends who are not in the VA, who either don't work with electronic records or those records are in their infancy, the VA is way far ahead of most other electronic record systems in other facilities, in non-VA facilities.
Well, when I had my little excursion with not being able to breathe, and I came in and talked to Dr. Murphy, I said, I want the hot doc to check me in the hospital. But he was a civilian. And so I told him I want my records transferred through the computer to the VA and vice versa. So the two doctors, like you're saying, will know what they're treating me for and what I'm taking and what not to take and all that. And it worked. It's wonderful. All I had to do was sign a paper with permission.
And it worked, yeah. The communication of information is, of course, a little bit easier within the VA, but there are certainly many veterans who get some of their care inside the VA and outside the VA, and we work hard to coordinate and work with the non-VA physicians. I've been in the VA only 4 years. Before that, I was in the community working at Roger Williams Medical Center and also Rehabilitation Hospital of Rhode Island in North Smithfield, where I still do some consulting work. So I know how the community system works. I know a lot of the docs in the community, so it's very easy for me to bridge that gap. And many of the VA providers either used to work outside the VA or still work part-time outside the VA. So there's
but many of them are veterans themselves, and they're
Yes.
very sympathetic
Yes, they
when a
are.
vet comes in.
Yep.
You get that little feeling of, gee, I'm going to get some decent care. He's going to be interested in what I'm telling him because,
Sure.
And there's
you
an
know.
understanding
Yeah,
that they
yeah.
understand.
Do you go through that problem when they come into you?
No, I haven't had that problem. I haven't
That
had
you
that
kind of
problem.
have to weed them so that you can push them in the right direction?
Well, generally the veterans that I see, I'm seeing them initially, their initial introduction to the
beginning, yeah.
VA. So they're very thankful and appreciative of any help that we can give them and guidance. And I provide case management, so I'm someone that they can call if they have a question or they're not sure, and I can guide them through the system. So they have someone. So I don't find that I have much difficulty with that.
Yeah.
With-
And paperwork, do they have a lot of items they have to sign for clearance? Or do they need the 214 when they see you?
The thing when they come into the evening clinic, they need a DD-214, and that establishes their care in the VA, which is very important. And they're encouraged when they come home at welcome home events to come to the VA to contact us, bring their DD-214, and enroll in the VA, so that then they're all set. And they can begin their care for whatever they need.
That's
We
the
try to
number
make
one
it as
program
simple
is
as
that
we can.
I stress that on every program practically. You need your 214.
Yes, you do. You need to
Before
have
you
that.
leave Iraq, Iran, or anywhere you happen to be, make sure that thing is up to date.
Yes.
Make sure everything that's happened to you, from losing a toenail or whatever or anything, it's down. Because when they get here and they have a problem, everything relates. And
Right.
if it's not there, then they got to wait to go get it all brought up to date. You
Right.
know, and
But there are people at both the Providence VA and at the regional office to assist in getting that, because sometimes that could be overwhelming. Coming
It
back
could take time,
Yes.
and they're ill, and you need service almost
Right.
immediately.
We have
you know.
enough available agencies like the VBA who are involved and active so that we really work very well together to help the veteran with whatever they need. We try to take the stress out of it for them because it's stressful enough coming home, readjusting.
Do they bring family, like the wife or
Yes.
mother, father, and you speak with them also?
Yes, we'll speak with the veteran's permission. It's all based on
Oh,
their
yeah.
permission. Yes, we're available to meet with family. A lot of the veterans come in with their partners, their spouses to the clinic, and we're more than happy to sit and explain
'Cause that's a
at least the
big,
piece.
big help. Too.
Oh,
Yeah.
sure, because these the medical conditions that the veterans are dealing with become a real family affair. It affects not only them, but their spouses, parents, and children, and we all recognize that. So it's very important to include the family as much as the veteran would like the family to be included.
Well, most of them need that support.
Oh,
anyway.
Yes.
absolutely, absolutely.
Other veterans across the country, they all have the similar facilities that you have, right?
Yeah, each VA has some basic primary care at the very least. Each VA facility, there are the larger hospitals, the smaller hospitals, and the outpatient clinics. And depending on the facility, they have various degrees of depth of specialties. So, like the Boston VA has all specialties, including, for example, neurosurgery. At the Providence VA, we don't have neurosurgery on site. We refer to the West Haven VA, and we have a very good working relationship with the neurosurgeons
So
there.
one of my members had to go to Connecticut for service.
Yeah,
There's
yeah.
a specific reason,
If it's an emergency, the VA will cover it on fee basis to local neurosurgeons, either at Rhode Island Hospital or Miriam Hospital. But if it's not urgent, if it's something elective, usually they go to West Haven if they're in the Providence system. It has to do with how services are provided and how the hospitals are organized and covered. But I've been very, very pleased with the neurosurgical service in West Haven. It is less convenient because of the distance, especially for our patients who come up from the Cape. But the vast majority of veterans who've had to go to West Haven Neurosurgery have been very pleased with both the consultation and the outcome of the surgeries. So I think it's worked out. It's not perfect. It would be nice to have somebody on site, but the number of neurosurgical procedures that are necessary for Providence VA patients isn't enough really to have a neurosurgeon right on site. But maybe that'll change in the future.
Now, the only one question: do you enjoy your work?
We love it. We're having. Well, I'll speak for myself. I am much happier as a physician in the VA since I've been here the last 4 years than I was before. The professional satisfaction that I get from evaluating and treating veterans is second to none. And also in terms of professional development and opportunities, the Providence VA is a teaching hospital. We have Brown medical students and medical residents in training and neurology residents who rotate through there. So it's an academic institution. There's a lot of teaching that goes on. And we do some research there, and the patients are wonderful. So I love it there.
Marie?
I feel the same way. I worked in a community hospital for a number of years, most of my career, and coming to the VA, it's just about 3 years I've been there, and it's like landing in Oz.
It's not that far from New Bedford to go to
No,
work.
it's an
either,
easy
is it?
commute, and the population is wonderful, and it's really given me an opportunity to really understand what the veterans, what they face, and what they're dealing with, and what they've
Civilians
done.
don't realize. Yeah.
Exactly,
Yeah,
and
they really don't.
it's professionally, it's a wonderful, I feel respected and encouraged. It's a teaching facility. Professional development is encouraged
Do you want
and
to go back to
supported.
school and be a doctor too?
Well,
So specific area.
no, I'm pretty settled in my social work career.
Good. It's
but
a
it's
big
wonderful
job in
environment.
itself. Yeah. Family. You have any veterans in your family? I know
Yes.
you're not a veteran, neither is the doctor, but you have veterans.
My grandfather was a veteran, World War I. My uncle was, lost in World War II early, young man. And my father was a veteran, World War II.
Oh, was he ever a Legionnaire? Do you know?
He belonged to the American Legion.
He did?
Yeah,
Then you
yeah.
could become a daughter of the Legionnaire. You know, we'll
Oh,
get
can
you
I?
in our auxiliary.
And let's see, my meme was a Gold Star mother.
Good for
and
her,
so it's
yeah,
something
poor
that
thing, yeah,
we
in that
appreciate
sense.
growing up,
Yeah.
their role in
That means she
the
lost
military.
someone in the military.
Yeah, she
the
lost her
Gold Star.
son.
Yeah.
Yes.
For those that don't realize, that banner with a gold star means you've had a deceased member. Yeah. I had blue ones I was giving out for the ones that were overseas now. They were there, showed that people had people in the service. But thank God they didn't have to turn to gold, you know.
Yeah.
They came back, and next thing I know, the curtain was down,
Yeah.
you know.
Yeah.
And Doctor, your family?
My father was a World War II veteran. He never went overseas. He was injured. He was trained as a glider pilot and was injured in a training exercise, so never went overseas. He was also a musician and played in the in the jazz ensembles on basses and
Before your time.
before my time, but he was very proud of his service, and I was very
They
proud
usually
of him.
are. They
Yeah,
are.
yeah.
You ever see an old man walk down the street in his 80s or something, and he'll see a friend right away, his back goes up and he
Yes.
says hello, you know. And poor thing, he's been struggling to get along, but he's got that pride in him.
Yeah, absolutely.
It's a
and with
wonderful
good
thing.
reason.
Or parades, or they see a flag or something.
I use a
there's
car now. I don't walk like I used to. I gotta go. That feeling
Yes.
is there. I can't stand and watch it go by me. I've got to be participating
Right.
somehow, you know.
But certainly it's been a huge education for me, and I try to educate my students and residents to understand what veterans have sacrificed and what they've been through, and I feel that we can't help them enough after what
Something's
they've
got to
been
be
through.
done so that they're frozen. They're never touched. Whatever they're getting, they've got to keep.
Yeah,
You
yeah,
know,
yeah.
because it's strictly political that way, and it hurts.
Well,
too
what
much.
the experiences they've had, as they've described to me, are are just unimaginable, and affects them and affects their families, their children, probably their grandchildren as well. So it's not just 4 years and you're out, or however long they serve. It's even if you're discharged young, it's a lifelong commitment, and it affects them for the rest of their lives.
Absolutely.
Americans are gentle people. We're not used to this thing they call war.
Yeah.
Other countries, I think they're more immune to the sorrows, but it hurts us a great deal when we have anyone come back that's hurt.
Yeah.
Well, I think we made a half hour, Marie. I
think we
Thank
did.
you very
Thank you
much
so
for
much. It was a
coming.
pleasure.
Thank you, Doctor.
Thank you very much.
And anything new comes across, let me know. We'll get you in.
Absolutely.
I usually give my guests at least 6 to 8 months so they can progress in there, whatever they're doing, and I get new information.
Oh yeah, we're developing things all the time.
Thank you, Nubet, for joining us on our next program.
What we do to the planet, we do to ourselves. You can help keep America beautiful. Visit KAB.org.